the session on Facebook, and then we will start. Good morning, good evening, doctors, nurses, and pharmacists. I am Dr. Che, and today we will discuss some important writing tips. And if you can share this session with other doctors, nurses, and pharmacists, that would be great. Just let me share the session, and then we will start. Okay, can you see my screen? You can unmute and you can talk with me if you wish. Can you see the case notes on my screen?
Yes.
Okay, can you see the case notes on my screen?
Yes.
Okay. Okay, so can anybody tell me how much time we have? How much time we have in the real exam
45 minutes.
for writing? 45 minutes, okay? And how we will use these 45 minutes? How we can use these 45 minutes?
5 minutes for reading and 40 minutes for writing.
5 minutes for reading and 40 minutes for writing the letter. Okay, and the 5 minutes that is reading time, what we can do? What we can do? What we can do in these 5
decide
minutes?
what's the relevant information we need to include it in our writing.
Yes. What else?
We will read carefully and then we can write.
I think we will go to the purpose of the letter, and we will select our sentences according to that purpose.
Yes. Okay. So in the 5 minutes, first we will read, the case notes. Those people who are on Facebook, I can also see your chat if you want to participate. Okay. So first 5 minutes we will use only for reading. So you will read the case notes. You will see which type of letter it is, which information is relevant, which information is irrelevant. Okay, you can plan in these 5 minutes, but you cannot write anything. You cannot underline anything. Even you cannot pick up the pencil in your hand. You can just read without doing anything. Okay, so now, for example, let us take this real example. These are the case notes. You are a doctor or nurse at a Green Valley Hospital. Read the case notes below and complete the task. This you will do quickly, okay? After that, where we should go? Can anybody tell me where we should go after that?
We should go to the
Writing task.
Writing task, very good. Yeah, very good. Okay, so we should go to the writing task. So let us read this task. Using the information in the case notes, write a letter to patient's general practitioner, mean GP, Dr. Che, for continued care and follow-up. So this is the name of the reader of the letter. GP Manchester, GP surgery 30 Smithson Street, Manchester. Okay. So what comes in your mind after reading this task? Anybody can tell me? What comes in your mind after reading this task?
Plan after that.
What comes in your mind?
Yeah, the type of letter I think is discharge letter.
Is discharge letter? Yes. What else it comes in your mind?
And what is the purpose for follow-up?
Known case.
For follow-up, yeah, is for follow-up for continued care. Okay.
Known case. Patient known
Known
case.
case. Why it is known case?
Patient general practitioner.
Patient general
Okay.
practitioner. You are writing to patient's family physician, general practitioner, family doctor. So they mostly already know about the patient's, chronic, diseases and, history.
Patient's history, we come to know about patient's history.
Yes. And you can also see my WhatsApp number also. This is just
Yeah.
joke. Okay. Yes, just joke. Okay. So after that, what we should do? So I'm just doing like in the real exam. Okay. You have read the writing task and you are still in the first 1 minute of your reading time. So what you will do? What you will do
Then we
after that?
go to the first page of the letter of the tax and try
Yeah.
to select the relevant information that we need.
Okay, first we need to go through the case notes so that we know what is the case and what is happening. Then we can decide what is relevant or irrelevant. Okay. So I will quickly see name. We don't need to read the name, just name, gender, date of birth, admission date, discharge date. Okay. Social background is married, Australia, retired NHS manager, double story house. Okay, all of these things. Okay, then past history is smoking, drinking, drinking. Okay, so allergies, diabetes, osteoarthritis, hobbies, family history, older sister, rheumatus, mother, hypertension, and surgery, total knee replacement. Okay, this was the surgery done. Okay, so now when we are reading for the first time, please mute other people, please mute. Only those who want to participate can unmute. Other people, please mute. Okay, it becomes difficult. Okay. Okay, so we will just quickly read what is social background, past history, family history, just quickly, because in the first 5 minutes, we are taking just overview of the task. Okay, current medication, these are the current medication, even we don't need to read the names. Then our admission date is 12, and this is when the patient came, was admitted and underwent this surgery. On this day, next day, general anesthesia was given. Then was admitted in ICU for next 24 hours for recovery. And medications that we have given on the first day after surgery, deltaparin for prevention, antibiotics, analgesics, and IV fluids. Then we have inserted urinary catheter. We have done dressing. Okay, just before we read each visit, we need to see the dates. Okay, this is 12th of November, 13th of November, and then 16th. This is the discharge date. Okay, and this is the discharge plan. So we need to keep in mind these dates. Then we have done, we have inserted urinary catheter. We have done dressing. We have advised not to walk during recovery, and This is the examination, saturation, BP, pulse, okay, respiratory rate, all of these things. Okay. On the next day, patient was transferred to the ward. Dressing was changed, was helped to walk with crutches, and demonstration issued and leg raised, and was switched to oral morphine and liquids. This letter is, mostly for nurses, because mostly nursing letters come like this, okay? But doctors can also get a similar letter, okay? So this was the, examination, and these are the investigations, okay? We are suspecting atelectasis because chest X-rays shows consolidation in the lower half of lungs, okay? Saturation is 99%. There is temperature, okay? And we are suspecting atelectasis, and we have started the patient on physiotherapy and deep chest exercise. Next day, that is today. This date is today, so try to use it as today, okay? Today's respiratory symptoms are improved: no cough, no fever, no shortness of breath, vitals are normal, patient is walking with a stick, and still need help for daily activities, and dressing was changed, okay? Dressing of wound, definitely. Then we have discharge plan. Occupational therapist should visit home. Home visit of occupational therapist was arranged within 5 days to review home condition. Okay, and then community nurse should visit to educate on wound care and change dressing daily until removal of stitches. And stitches removal is scheduled after 2 weeks, and we need to continue breathing exercise in physiotherapy. Avoid driving and lifting, heavy lifting for 6 weeks, and arrange social worker to help in daily life activities like cooking and cleaning. Okay. So now you have overview of the letter. Just think that you have done this in the first 5 minutes of reading time. And now you are going to plan how you will write the letter. Okay. You can also do, you can think what is relevant, what is irrelevant. For the social background. Okay. Please mute other people, please mute. Okay. It becomes, disturbing for others. For me, there's no issue, but Okay, social background. She is married, lives in Australia, NHS manager, double-story house, entrance, kitchen, ground floor, washroom. Is there any need of these things?
No.
You're writing back to GP, and GP knows about these things. And no, the GP does not need any of these information to continue the care of this patient. You need to see the, circumstances to whom you are writing. If you are writing the same letter, to occupational therapist, if you are writing the same letter to occupational therapist, so what is occupational therapist? What is occupational therapist? What is occupational therapist? Occupational therapist is a person, a medical person who comes to patient's home. They assess whether the patient's condition is okay for the living conditions that he has. For example, if the patient has undergone knee replacement or hip replacement, and if there are washroom is in the upper story on the second floor, okay, so then occupational therapist will just do the assessment that this patient needs washroom on the first floor, okay, on the ground floor. For example, if there are steps at the entrance and patient is using wheelchair, then the occupational therapist will do this assessment. If the patient has a workplace, they will do the assessment of workplace to see if patient can work according to the work condition or not. Okay. So if the same letter is for occupational therapist, then we will write the important things from here. But for GP, we don't need past history. Do you think we need any past history for this patient for this discharge letter?
Yes, we need past history.
Which history?
Yes, sir, obviously.
Smoking? Why?
Osteoarthritis.
BMI.
Why? Why?
Sir, it increases the risk of embolism, I think.
You don't need to overthink, okay, in OET. Just pass your exam and chill, okay?
sir.
Don't overthink.
Past history is important because of to understand the next person means you have to understand why the patient which kind of problem she is suffering from because of that
That could be past history of the,
the person
he
needs
underwent
to
this. But even if you want to mention, just mention the names that he has a history of diabetes and osteoarthritis. Okay. The rest of the
yeah,
things, smoking and these things are not important.
Yes.
Okay. Let me see in the.
Yeah.
Just 1 minute. The model answer. I didn't include any of these past history in my letter, okay? So you don't need any of these things. Even if you want to mention, just mention he has a history. Please note, he has a history of diabetes mellitus type 2 and osteoarthritis, for which he takes these medications. But even current medications are important in this letter, okay? So these things are not important. Family history of sister, mother is important or not?
No.
No. I don't think so. It is important.
It's not important. It's not
It's not
important, okay?
important.
Yeah.
Not important. sir. Not
Name
important.
of the surgery is important because you will write in the purpose and everywhere, okay? Current medications.
Important. It is important.
It's important.
Yeah, you don't know. You don't know which medication patient was taking already, okay? But current medications are important. The reason is, what is the reason?
Because doctor will know about her medication.
Definitely, this is the main purpose of letter. The patient, the GP can continue. For example, you are an orthopedic specialist, okay? And now you're sending this patient back to GP. GP will continue care of this patient. This is the how, the health system works in developed countries. So GP will continue the treatment of this patient. So GP will continue medication, not only medication. GP will make sure that occupational therapist visits his home within 5 days. GP will ensure that the community nurse visits, okay, for dressing and these things. And he will ensure stitches removal. He will continue these physiotherapy exercises. And he will advise the patient to avoid lifting and driving for 6 weeks. And he will arrange for social workers. So all of these things are for the GP. The discharge plan, okay? Okay. So now current medications are important, okay? So now you have 3 dates. First date when the patient was admitted. Next day when the patient developed some respiratory problem, and today, that is 16th, when the patient is being discharged and patient is okay. And then you have discharge plan, okay? So let us try to make a plan, okay? Can you see blank page on my screen?
Yes, sir.
Okay. What I have written there?
Yes, sir.
What I have written?
Purpose.
Okay. It means you can see. It means you can see. Okay. So after purpose, we have initial visit. Okay. Then we have second
Sir.
visit. Yeah, second date. Then we have today's visit. Then we have past history. We can use slash social history. Then we have discharge plan. Then we have conclusion. Okay. In this letter, mostly discharge letters are like this. In this letter, do we need anything about past history, social history? Do we need
Except
anything?
diabetes.
No,
sir.
sir.
Past
Yeah.
history, social history? No. Okay, so we will
No.
No.
remove this. Okay, let us remove this. Okay. No, let us keep it, but remove. Okay. Now discharge plan and conclusion. Mostly sometimes we write a discharge plan then conclusion. Can we write one paragraph for discharge plan plus conclusion together?
Yes, sir.
It would look better, okay? Your discharge plan would be your
Conclusion.
conclusion, okay?
Okay, sir.
So how many paragraphs we have in our letter?
5.
5.
One
5.
purpose, second initial visit, second visit, today's visit, discharge
Visit.
plan. Okay. Now I'm going to plan. Now I'm going to plan where I should focus more to write a concise letter. The word count should be between 180 to 220. As I mentioned, the discharge plan. In the discharge plan, we have to ensure occupational therapist visit, community nurse visit, stitches removed after 2 weeks, physiotherapy, we need to continue exercises. We have to advise the patient about avoid this and that. And we have to arrange a social worker to help the patient in daily activities. Now, my question is there anything that is not related to GP to do for this patient?
No, sir.
All things are important for GP to do.
It is important to keep an eye on all these things.
All of these things for GP. Okay, the same letter, if you are writing to occupational therapist, what you will write in the discharge plan. All of these things are just the first line.
Like we can see he give importance on his physiotherapy and avoid for heavy lifting, and also so we can write all these things as well.
Almost,
Almost.
no. We will focus on what occupational therapist will do. Stitches removal, we don't need. Community nurse visits, we don't need. Okay. Exercises and physiotherapy, yes, we can write. And lifting and these things we can write. Okay. What I want to say is you need to change your plan according to the reader. Okay.
Okay, sir.
So, but here your reader is GP, and for GP we need almost all of these things. It means we cannot skip anything from discharge plan. Yes or no?
Yes, sir.
So we cannot skip anything, but what we can do?
Summarize all the things.
We can summarize, we can join similar things together. Okay. And
Okay, sir.
we can write, you cannot start like this discharge plan. So occupational therapist will visit within 5 days to review home condition, full stop. Community nurse will visit to educate patient on wound care and chain dressing until removal of stitches, full stop. His stitches will be removed after 2 weeks, full stop. Patient will continue deep breathing exercise and physiotherapy, full stop. Patient should avoid driving and heavy lifting for 6 weeks, full stop. A visit with social worker has been arranged for help in daily life activities like cooking, cleanings, full stop. So you have 1, 2, 3, 4, 5, 6 sentences, and each sentence is a separate thing. Okay. So this is what mostly students do. They just read and they write one line. They read and write one line. This is not what we need to do. We need to join similar things together and we need to organize very well. Okay, I will show you how to do this, but just I'm telling how to plan before you start writing. So in the discharge plan, you will write all of these things, but very concisely and in a very professional way, but you cannot skip these things. Okay. Okay, so then, sorry. Okay, then we have initial visit and the next day visit. In the initial visit, patient underwent this surgery and then he was admitted in ICU for 24 hours. These, for example, names of medication that Daptoprin was given to prevent DVT, antibiotics, analgesic, morphine, name, frequency, IV fluids. So do you think we need all of these things?
No, sir.
Just their names are enough. Okay, their names are enough. And if you are a doctor, you should focus on the medication and the examination. If you are a nurse, you can just a little bit, focus more uric acid inserted and dressing and these things. Okay, but overall, both of you can write these things. So we will be very concise in this, initial visit. Then in the next visit, the patient was transferred to the ward, and then everything we have done. The new thing that happened after 36 hours after surgery, after 36 hours of surgery, that patient developed, some respiratory symptoms, and we diagnosed as possible atelectasis with, a chest X-ray and with symptoms, all of these things. And we started the patient with physiotherapy and deep chest exercises. Okay. Then we have this today's visit. In the today's visit, patient has improved. There is no fever, nothing. Okay, just patient needs help for daily activities. Rest. Okay, and we have changed the dressings, all of these things. Those who have written this letter, those who have not written this letter, it looks very easy that you will just write first visit, next visit, today's visit, you will write then discharge plan, and then you will get B grade. Those who have not written. But those who have written, they know that it is not easy to organize the information in each visit. Yes or no? Anybody who has written and found it difficult, little bit difficult to organize each and everything? Anybody who can share his experience? Who has written this letter?
I tried to write the letter today, and I started from today, which is on the 12th of 11, 2022.
Yeah.
So before I now proceed to the 13th, then 16th, then writing the discharge plan. Actually, I didn't write anything about past history and the social history, since we are writing to the patient's GP. So I assume that the case is already known to the GP. So reason why I didn't include that. But
yeah, that is good. Good.
That's
okay.
What
Okay. So
Excuse me, sir.
in this letter, yes, please.
Sir, thank you, sir, for allowing me to speak. I have a doubt, not in this discharge letter. Sorry for that.
No
In referral letter, there are, because I didn't attended this any means OET exam. This is my initial period that I'm taking classes near to my home, and I have a doubt in this. If they are not mentioned like particular, if they are written there that the patient name, the patient's GP or something, then like a rehabilitator or rehabilitation center they are written, then they are not given the name, then what we have to write to that the area that what we have to fill
in the greeting part,
sir, in greeting part.
just write what they have written. For example, if they are written here, rehabilitation team, just write rehabilitation team. If they are written, if they are not written the name, if they are just written general practitioner, write general practitioner. If they have written like occupational therapist only, write occupational therapist only. So what is written here, you will just write. There is no need of any, rocket science here. So
Okay,
for example, these things are written here, you will write just in the, in your greeting part. You don't need to overthink about. If the name is not given, you can cite dear sir and madam. If they have written as a team, yes, you can write their team, okay, like this, their director. Okay, so this is, there is no need to worry about these things. The main thing is what you write.
Yes.
Okay,
Okay. Thank you.
okay.
Thanks so much.
So now let us first write a purpose. Okay, what you will write in the purpose, two things: what is wrong with the patient, and number two,
पता है ये हम यहाँ टाइप करके ना इनको भेज भी सकते
so
थे बहुत बढ़िया
so this is disturbing. If you want to speak, then unmute. Otherwise, try to keep it, your mics muted. Okay, so what you write in the purpose: number one, what is wrong with the patient, and number two,
from the reader.
what we want
Number
from the
two,
reader. Okay,
what we want the
from the reader. Okay,
the receiver
very
to
good.
do for
Yeah.
the patient.
What is the problem of this patient?
She
TKI.
has post-surgery complication.
No. Overall, the main thing is the patient underwent right total knee
Right
replacement.
total knee replacement.
Yeah.
Yes, sir.
This
Okay.
is just during admission. That is just minor details you will write during the visit. So you don't need to write atelectasis, possible atelectasis in the purpose. Okay.
Okay,
In the
sir.
purpose,
Okay,
just
sir.
who underwent right total knee replacement. Okay. Now
Okay,
you
sir.
can add he or she is being discharged today. And what we need from the patient, from the reader, and we need continued care and follow up. It's very easy to write the purpose. Okay.
Okay, sir.
Just
Okay.
believe me, if you write the purpose and the conclusion quickly and the greeting part quickly, then you will have almost 30 minutes. 35 minutes you can use as planning, and then you will have 35 minutes. In the 5 minutes, write purpose and the greeting part. And the conclusion is also very easy to write at the end if you practice a lot. Okay. So then you need to spend almost 30 minutes on the just body paragraphs. So you have written purpose, you have written greeting part, all of these things. So it helps a lot. Okay. I will just teach these things. Okay. So now, as this is GP, okay, we will start like this. I am writing to refer, or we can use something else.
Follow up.
I am not writing for follow-up. Follow-up we will use as what we want from the reader.
Regarding
Update को करें.
Regarding is when you don't have any idea. This is referral letter, discharge letter, what are you going to write, means update or refer or transfer, whatever. When nothing comes in your mind, then use regarding. Okay, it fits in every letter. Okay, but here we
Okay.
know this is discharge letter. Let us remove it. Okay, I'm writing to
Okay,
update
sir.
you. You mean
Okay.
the GP. Okay,
Mm-hmm.
I'm writing to update you on. Then write the name of the patient. Okay, what is the name of the patient here?
Mrs. Parker.
Nina
So we
Park.
will use Mrs. Nina. We don't need, just we need Parker. Okay, in mostly in nursing letters, nurses use complete name, but in doctors mostly we don't use first name. We just use same Miss Parker is enough. Okay, Mrs. Parker is enough. But in nursing, mostly in nursing samples, official sample, they write complete name. So it is up to you. Okay, it's up to you. But I will
Okay.
just write Miss Parker. Okay. Sorry, his second name. Yeah, Miss Parker. Okay. Okay. So
Nina
next, what we
Parker.
will write? Yeah. First, then what we will write?
Who has underwent?
Who has underwent is okay, but we can just write who underwent. Past simple. Okay. Has underwent is also okay.
Okay.
Just underwent. Okay. Who underwent?
Okay, sir.
Right. Total knee replacement. Okay. This is just one of the easiest way to write. Okay. She is being discharged today, and will require your, then we will use these words, okay? In the discharge, in the writing task. Continued care and
Okay,
follow
sir.
up.
Okay.
Continued care and follow up, okay? And will require your continued care and follow up. Okay. Now you have just written quickly these things, the purpose, okay? Now my question is, you need to find the mistakes in this purpose. Is there any mistake? Is there any mistake?
Sir, must be mentioned a medication.
Yes.
on
The
Medication, which medication?
the diagnosis, right total knee replacement should be in small letter
In small
and
letters,
not
why?
capital letter. Yes.
Why? Why the reason? I have written in the case notes. If you see in the case notes, I have written in capital, right? R capital, T capital, K capital, R capital. In the abbreviation, I have written RTKA. But why you people ask me to write it in the in small in the purpose? Why? Anybody can
Because we are
explain?
writing it in full. We are writing the right total knee replacement in full. So we don't
Yes,
have
we are writing in full.
only abbreviation that we write in capital letter.
Yes, we
That's
can write
just my
abbreviation
opinion.
capital. That is okay. That is good. But the other thing is, okay, we write the name of a disease or a procedure, name of a disease or a procedure in capital if the name is given after someone's name, okay? If the name of the disease is given after someone's name, can anybody give me any example?
So Parkinson's disease.
Parkinson's disease, very good, very good, very good.
Wilson's disease,
McDonald's.
Down
Wilson's disease.
syndrome, just use.
Hisprum disease.
Steven
Okay.
Johnson syndrome.
Yes, there are a lot of examples, okay?
Wilson's disease as well, sir.
Okay, so if the name is given after someone's name, then we will use capital letters, okay? Rest of the things, for example, diabetes mellitus. Hypertension. These we will write in small, okay? Why we use capital in the case notes? Because these are case notes. Case notes are just, short way to write. Okay, so here I can use as an examiner, I am using hypertension as capital. I'm using rheumatoid arthritis capital because these are the case notes. Okay, diabetes I'm using capital, osteoarthritis I'm using capital. Okay, but when you will write letter, you need to keep in mind these rules. So hypertension, diabetes, total knee replacement, all of these things would be in small. Parkinson disease, Down syndrome, these things would be in capital because they are given after someone's name. But there is still one error. Can anybody tell me what is the error here?
I think we need article.
No?
Maybe you didn't write in
The
it on
second
cap-
word we will start with small letters.
Who is there? Who is there? Who told this?
So me.
You mean you name?
Sadhna.
Okay, so very good, excellent. So even if it is given after someone's name, we still will use second part of the name in small. Okay, so disease D should be small, syndrome S should be small, Down D capital, Parkinson P capital, but D and S would be small. Syndrome, disease, these things are written in small. Okay, so one mistake. Any other mistake in the purpose? Any other mistake? Any other mistake?
What about continued care and follow up? Is it? I think it is same meaning.
Very good, excellent. Who is there?
Amira.
Okay, very good, excellent. So they're almost similar things, okay? Similar, continued care, follow-up are same things, okay? What do you want me to do?
To I think delete one
Remove
of them
one,
because
okay?
yeah, because this repetition.
Very good, okay? Let us keep like this, continued care. Anything else? Anything else?
Management.
You can write
No.
further follow-up care, you can write only follow-up care, whatever you want, okay? Use one of them, okay, not both of them. Please, rest of the people, please mute, because
Placement.
yeah, it should be in small, that is okay.
Small. Yes, that will be small.
Please, rest of the people just mute, and only one person should unmute and talk, because it becomes very difficult for others to understand, okay, what you people are saying. Okay. So who wants to participate? Any other mistake? Muzammil Sultana, you are unmuted. Anything you want to add? No?
Sir, I have a question here.
Yes, please.
Yes, sir, it's a roach. Sir, I didn't understand that part. You said that if we will write some disease or procedure which is after some person's name, then we will write it in capital, like
Yes.
Down syndrome, right?
Yes.
Sir, but if it is some simple procedure like we are discussing that knee joint replacement, we will write just first letter in capital.
No, we will write everything in small.
Okay, sir, we
So,
are right. It's still wrong, that means.
yeah, it's still wrong. It should be small. That is why right. It should
Right
be total knee replacement. No, it is green. Okay.
Okay, thank you so
It
much.
should be small. We write in the case notes, we write in the capital, because first these are case notes. Case note means just short forms, okay, to write. And other thing is we need to check our students, because this is exam, so whether they know the rules or not. So this is what they are testing for. So in the case note, you will see these things in capital, but you will write in small. But if you write the abbreviation would be capital, okay? RTK would be capital. RA, rheumatoid arthritis, would be capital. Diabetes, DM would be capital if you use abbreviations, okay? So another thing you can improve here, instead of will, what we should write?
Excuse me, I have a question. Yes, about will require. I think it is not a polite to use it. We'll change to maybe could require.
Would require, what is the reason? Because would require is polite language. People on Facebook, you people can also participate. If you want, you can participate. You can write something in the chat. I'm seeing your chat also, those who are on Facebook. Okay, so instead of will, we will use would require your continued care. That would be more polite language. Okay, good, done with purpose. So now let us move to initial visit. So what you will write in the initial visit? Patient was admitted, underwent surgery. On next day, general anesthesia was given. Admitted in ICU for 24 hours and during the recovery. Okay, and then medication. We have given this medication. We have inserted. Somebody asked on Facebook. Just seeing, we think it is easy. Yes, that is a very good question. Somebody asked on Facebook. Just seeing, we think it is easy. Yeah, it looks very easy, because you can see this is initial visit, and you are not going to say then we were at initial visit, then next visit, then today's visit, then discharge plan, and over here letter is done. It looks very easy, but when we write, it becomes difficult. Okay, it's a very good question. So how we solve this problem? We solve this problem with practice. Even some of my students who joined me in the previous attempts, they got 250, 260, 280 scores in writing. And after, my VIP hybrid course, they got B grade, 350, 360. So it's very, this comes with practice and what you need to include and all of these things. Okay. So now let us, okay. So then we have names of the medication. We will not write, a deltaprine, the dose of deltaprine, and it is used to prevent for DVT. No. We will just use analgesia, okay, or analgesic. We will not use morphine, its dose, its route, a lot of these things. Even IV fluids we can skip. These are not too important, but you can mention. Uric acid and dressing, these things you will mention because most of you are nurses and you can also write. But if you're a doctor, you can skip, you can write. It depends on you. In the examination, should we write each and everything? Is there anything abnormal in the examination with the vitals?
Abnormal things.
Our parameters are normal, okay? So we can write examination was normal, okay? So now it looks very easy, but it becomes very difficult when we will organize and write, okay? So now how you will start? I will start like this. I have written model answer already. Just I'm doing to show you how to do this, okay? We will use word initially on this date. Miss Parker, okay? So first I will write about admission and surgery. Some people say when you are using the name of the surgery and the purpose, then you can use she underwent above mentioned surgery, okay? And some people use the name of the surgery again, so it depends upon you which looks better for you. Vital is normal, yes, you can write, okay. Okay, so initially on this date, Miss Parker, actually on this date, she didn't underwent for surgery. She underwent for surgery on the next day, okay. And so I will use admission and surgery in one sentence. She was admitted and underwent surgery, okay, as one sentence. Miss was admitted and underwent. Now I can use the abbreviation, okay. Here I have written the complete word. Here I can use the abbreviation RTKR like this, okay. RTKA. RTK. You can write the complete name also if you wish, okay. An event RTKA. You can write the date on the next day. Or what you can do, you can skip was admitted and you can write what happened after the surgery, okay. So was admitted to hospital and underwent surgery. On this date, general anesthesia was given and admitted to ICU in next 24 hours. Okay. So we will write like this. Miss Parker was admitted and underwent RTKA. Okay. Then we will write about ICU is very important. We can use examination ICU together. Her examination was normal, her high vitals were normal, and she was admitted in ICU for next 24 hours, maybe like this. On examination, her vitals, we need a comma here. Her vitals were normal. and she was admitted in the ICU for next 24 hours. Okay. So we have written about examination, we have written about ICU, we have written about the procedure, all of these things.
Sir, can we say it further shifted to ICU and transferred to ICU?
Yes, is also okay. Admitted. Yeah, it was transferred. Is also okay. Admitted. No, where was she? Then was she shifted? Would look better. Good. Thank you. And she was shifted to
She
the
was shifted
ICU.
to ICU for further
Yeah.
management.
Yeah, we used to use the with departments. Okay, that's okay. This is what we need to plan when we're writing, because in the exam you need to plan before you start, before you write sentence. Okay, so now you have three things. Advice: cannot work during recovery. This is not too important. Okay, cannot work during recovery. This is not too important. Okay, so 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 we have urinary catheter, dressing, and the medications. We can write as one sentence. All of these things would look better. Okay, so we can write like a urinary catheter was inserted.
Simply, we can also say that catheterized.
No, that would become a little bit high level. Okay, now go to that level. Okay, catheterized should
Okay.
be, it could be anything. Catheter could be anywhere. Okay. Okay, so then I will use these catheter and dressing as one sentence, and the medication I will use in the next sentence, because if we join all of these things together, it becomes too, too long. And her dressing was changed. Okay, one sentence. This is the mistake that commonly mostly students make. They keep writing all the things in one sentence, and then it becomes very difficult for the reader to understand. I will show you when I will mark your letters. Okay, and then we need to write the medication. She was given or she was commenced on deltaparin, antibiotic, analgesic, and IV fluids. I will use given because given looks better than administered. Uh, she was given, she was administered is also okay. Deltaparin. Deltaparin, okay, spelling. Deltaparin. Deltaparin. Then you just use the name of deltaparin. Okay, don't use the details because you are writing this as initial visit. We don't need too much details. Antibiotics, or we can use commenced on also. She was commenced on antibiotics. She was commenced on would also look good. Okay, she was commenced on deltaparin, antibiotics, analgesics, and IV fluids, comma. We don't need details of morphine, analgesics, and IV fluids. Okay, now this is your initial visit. You can see how easy it is to understand. Initially on this statement was admitted and underwent RTK. You can write the complete name on examination, her vital. You can write above mentioned surgery also. Her vitals were normal and she was shifted to the ICU for the, we need the with time, okay, for the next 24 hours. A unique acid was inserted and her dressing was changed. She was commenced on this, okay. As we are writing this letter for doctors and nurses also, so we need to keep these things in mind. Okay, done. She was shifted to the ICU and her examination was unremarkable. First we will write the examination, then ICU would look better. Unique catheter was placed is okay, but inserted is most commonly used with urinary catheter. Okay, placed is not commonly used with urinary catheter. Okay, so now I will show you my model answer where I have written the initial visit. Okay, here. I think, okay. Okay. Initially on this, Miss Parker underwent RTK and was admitted in the ICU where her vitals remain stable. So you can see how I'm joining a lot of things together. So I have written, this is when I write in the, and when I'm not teaching, I'm just writing the, uh, samples. She underwent this, was admitted in the ICU where her vitals remained stable. Okay, it can be like this also. So I'm writing vitals, admission, ICU, all of these things together. Don't try this, okay? Because you will lose a little bit, okay? She was commenced on dalteparin, antibiotics, and analgesics. I have skipped IV fluids because this is not too important, okay? She was transferred to the ward after 24 hours and was switched to oral morphine and liquids. She was helped to walk with crutches and antibiotics were issued. I think I am using some information from the next. Okay. Okay. Let me see model answer. Yeah. Okay. I will tell you why. Okay. Then on the next day, this is also the next day when you are in the ICU. This is also the next day. She was transferred to ward on the next day. Okay, after 24 hours. Then her dressing was changed. She was helped to walk with crutches. Anti-embolic stockings were issued, and her legs were raised, and she was switched to oral morphine and liquids. Then after 36 hours of surgery, she developed symptoms of atelectasis. What I have done, instead of writing a separate visit for next day, 13th, and the when the patient is admitted here for 24 hours in the ICU, and then after that he was transferred to the ward, and then we have done crutches and embolic stockings and these things. So what I have done is in the planning, what I have done, I have written in the initial visit, in the initial first paragraph, all of these things together. And then in the next, where it is important, the atelectasis, I have written one separate paragraph. It becomes very obvious for the reader when we write like this, okay? Because we're focusing on respiratory symptoms in the next, okay? So you can write till this point in the first initial visit, okay? So let me show you again. She was transferred to the ward after 24 hours and was switched to oral morphine and liquids. Okay. She was helped to walk with crutches, and anti-embolic stockings were issued. So I'm writing the main things from that, visit, from that time. Okay. Then something is happening after 36 hours. Can anybody tell me how you will write about these 36 hours? Can anybody tell me, please? Yeah, please mute. Okay, please mute. I will remove from the class if you keep doing this. So can anybody participate and tell me what you will write in the next paragraph? What happened after 36 hours? What you will write?
We can write also that her condition, his condition was aggravated and like this type, I think.
So this is okay, but this is just for us, her condition aggravated. But here you need to prove what aggravated exactly. Okay, so let us read here. There is fever, there is cough, there is shortness of breath. In the vitals, saturation is 99%, temperature is 38, respiratory is 26, pulse is okay, BP is okay. There is decreased, there are decreased sounds, okay, respiratory sound at right lung base, okay. And the investigation we have, ordered for blood count and X-ray. For blood count is normal, but X-ray shows consolidation on the lower half of right lung, okay, just lung without S. We are suspecting here possible, this question mark mean possible atelectasis, and then we have done physiotherapy and deep chest exercise for this patient. So we will write these things together in one paragraph. Now, can anybody tell me how you will write it? Anybody who has not written the letter? Anybody who has not written the letter?
So we can, I think, simply write that he developed sign and symptoms of atelectasis.
No. This is very common mistake. Yeah, this is common mistake. She developed signs and symptoms of atelectasis. This is what we write in the purpose when there is some new diagnosis, there is new diagnosis, and we want to write in concise way. Okay. Here in the body paragraphs, you cannot write just he developed signs and symptoms of diabetes, he developed signs and symptoms of TB, he developed signs and symptoms of this. No, no, no. Write the signs and symptoms, write them.
Yes, sir. Sir, then we can better go with a fever, cough, and a SOB. All
Yes.
vitals were normal except chest X-ray.
No,
Which
vitals are
showed
not normal. There is temperature, respiratory rate is 26. These two things are very important. In the examination, decreased sounds are important.
Yes.
And then the X-ray. Okay. It looks very easy, but it becomes difficult when we write. Okay. Let us try. Okay. After 36 hours.
After
Okay.
36 hours, his condition was critical.
No, we will use name of the patient when we start new. His condition was critical. No, doctor, don't use, your imagination. You can write her condition was aggravated, but try to use what is written in your case note. Okay. I will use the things that are written there. Okay. Miss Parker developed, okay, fever, cough,
Okay.
and
Also got SOB.
shortness of breath. You can write complete shortness of breath or SOB, whatever you want. Okay. Then saturation is not important because 99%. Temperature is important, and the respiratory rate. Okay. And then in the examination, we have decreased sounds at the right lung base. Okay. Our temperature was 38. We will use sign of degree centigrade, and our respiratory rate was 26. Even you can skip respiratory rate. One of these things you can skip. Okay. Auscultation of our right lung base showed revealed decreased sounds.
Sir, in first line also you entered, explained about the fever. But in second line, we are also going to explain about the fever 38.
Excellent. Excellent. I really like this. Okay. So these things come in the conciseness. Okay. First, I'm just writing. Okay. So then we will improve it. Okay. So it's very important. You are writing fever here and you are writing temperature here. So this is just repetition. You can skip. Okay. Auscultation of our right lung base revealed or showed, okay, decreased respiratory sounds are only sounds, and then her X-ray revealed or showed consolidation. Where is the consolidation?
Right lung, right lung.
On lower half of right lung. Okay.
At the lower lobe of the right lung.
Yeah, lower of lower. Just use the same thing. Okay. Lower half of the right lung. Okay. So then we are suspecting something and we have started the patient on these. Okay. Atelectasis was suspected. She was commenced on. And deep sizes. Okay. Now this is, traditional style. This is traditional style. Okay. Welcome, Noreen Kamal. Thank you. So,
Sir, can we
so this is a
mention
traditional way. Yes, please.
her chest X-ray revealed consolidation at lower like this? Can we
Yes,
mention?
yeah, that is also okay. Okay, so this is classical way. Okay, classical way means when you want A grade means 500 out of 500. So then you write just what you see here, then you change it into a sentence. Okay, so you have seen here patient comes with fever, cough, shortness of breath. You have changed into one sentence. Then you see in the vitals there is a temperature and respiratory rate. That's just you write it as one sentence. Okay, then you say there is auscultation, shows some decreased sounds, so you write one sentence. Then you see X-ray revealing this, so you write one sentence. Then you see that the possible diagnosis atelectasis, you write one sentence. Then you have commenced the patient on these things. So what you think? This is what should be the grade for this paragraph?
C grade.
A C plus. Okay. If you are a doctor, C plus. If you are nurse, C. Okay. Because we want you to keep away from your target. So if your target is B, then it could be C plus. C plus is equal for you. So it's just very basic levels. So you just said he developed fever, cough, shortness of breath. Then his temperature was this. Auscultation revealed this. X-ray showed this. Atelectasis was suspected. He commenced on physiotherapy. So this is very basic way. What you need to do, you need to organize. This is what mostly people, they don't know how to do this. So you need to join similar information together. Okay, join similar information together. For example, you can join these two. Atelectasis was suspected and she was commenced on physiotherapy and deep chest exercises. So you can write these two sentences together. Okay, and then you can write examination together. Okay, or maybe you can write examination plus the symptoms, and you can write X-ray separately. Okay, so this is what you can do. Okay, I will show you. Okay, and my model answer what I have done here. Okay, so you will feel the difference. Okay, after 36 hours, Miss Parker developed fever, cough, and shortness of breath. It is okay, keep it simple. That's good. You can easily understand what happened. Okay, her temperature was 38. Even you can skip, but to make a good sentence, you can add. And there were decreased sounds at the base of her right lung. So I am joining together. Examination, temperature, and chest auscultation. Then her X-ray revealed consolidation, and she was commenced on physiotherapy and deep chest exercise. Even I skipped atelectasis. That is not very important. Okay, you are writing overall respiratory symptoms. So this is a simple sentence. This is a compound sentence, and this one is a compound sentence. So one simple, two compound sentences. This is a very good paragraph. It's very easy to understand, very easy. After 36 hours, Miss Parker developed fever, cough, and shortness of breath. Her temperature was 38, and there were decreased sounds at the base of her right lung. Her chest X-ray revealed consolidation, and she was commenced on physiotherapy and deep chest exercises. It's very easy to understand.
Is it possible to use brackets?
You can
For
use
example,
bracket, but just avoid
for
them.
example,
Just
developed fever, and I could. Is it possible to write the temperature in brackets
yes, you
next
can
to the
write in the
fever?
bracket here, but mostly in OET, when you're writing sentences, when you're writing paragraphs, try to avoid brackets because this is a little bit informal way. You can use, it is not wrong, but try to avoid.
Okay.
Just use where it is almost, you cannot skip. Otherwise, try to avoid. Okay. So now next is you will write what you will write next. Today's visit. Okay. In the today's visit, you say respiratory symptoms improved, no cough, no fever, no shortness, vital signs normal, walking with stick, still needed help for daily activities, dressing changes. You can see there are a lot of things, lot of things. So if somebody like me who wants 500 out of 500, they will write like this. On today, her respiratory symptoms have improved. Full stop. She has no cough, fever, or shortness of breath. Full stop. Her vital signs are normal. Full stop. She can walk with a stick, and she still needs help with daily activities. Full stop. Her dressing has been changed. So almost 4, 5, 6 sentences. This is a very basic level. Okay, very basic level. So what do you need to do? Write just one sentence or two sentences, very well organized, and include all the important things. Okay, I will show you what I have done for this.
You mean, sir, we will minimize it?
No need to minimize, just write the important things. Okay, I will show you. Don't write 4 or 5 sentences for this. Today her condition has improved as she has no cough, fever, or shortness of breath, but she still needs help for her daily activities.
Okay.
But most of us at the start, when you are just starting OET and you are new, you will write like this. Today, her respiratory symptoms have improved, full stop. She has no cough, fever, or shortness of breath, full stop. Her vital signs are normal, okay, full stop. She can walk with a stick, but she still needs help with, she still can walk with a stick, and she need help with daily activities, full stop. Her dressing has been changed. Dressing changed is something you can skip, okay? Her condition has improved. This is the important thing, and she needs help in daily activities. These two things are important overall in this visit, today's visit, okay? You can compare with
Right.
your letters, what you have written. So most of you have sent me the letters. You can see your own letters, okay? Today her condition has improved. Why it has improved? As she has no cough, fever, or shortness of breath. Even I am giving the reason why her condition has improved. Her condition has improved as she has no cough, fever, or shortness of breath. And then I'm continuing the same sentence, but she still just okay. But she still needs help for daily activities. Okay.
Right.
So now try to think what you will write in the discharge plan. Okay, I'm coming back in 2 minutes. I need to see a patient. So now we will discuss the last this discharge plan. It's a very important thing. Discharge plan. If you write each of these things in one sentence, so then you will be doing the same thing that I told you in this today's visit. Okay, so now think what you will do with discharge plan. Okay. Okay, can you hear me?
Yes, sir.
Okay, so we have some, if you are from Pakistan, we have some news about Ramadan.
Yes, I am.
Yeah, so tomorrow we have first Rosa. Okay, so yes, so it was, I just saw this news. Yes, they have just announced no. Okay, so in the discharge plan, so let us just discuss quickly because we have to prepare for prayers and these things. So in the discharge plan, you can see that there are a lot of things. Okay, so you need to organize them together. Okay, I will show you the model answer. Okay, because now we are a little bit quick. We need to prepare for prayers. Okay. Okay, you can see I would be grateful. This mostly we use at the start of conclusion. So I'm using conclusion at the same time discharge plan. If you could advise her to avoid driving and heavy lifting for 6 weeks. So what I'm doing, I'm using this conclusion and I'm using the advice that we are going to give. Okay, you can use any other thing here. I would be grateful if you could arrange occupational therapist home visit within next 5 days. So we can write a sentence like this. Okay, so you will use one sentence. Please ensure community nurse visits to educate her on wound care and change her dressing daily until removal of stitches after 2 weeks. So you can see that I have written wound care, changing of dressing, and stitches removal, this part in 2 weeks together. So I have written one sentence for these 2 points. Okay, you can see these things. Please ensure community nurse visits to educate her on wound care and change her daily dressing until removal of stitches. Until removal of her stitches, maybe her stitches after 2 weeks. Okay. Then about home conditions. Okay. Occupational therapist. Okay. To review home conditions. So occupational therapist will visit to review home condition. Okay. So we were right. Her home condition should be reviewed by occupational therapist. OT mean occupational therapist within 5 days, and physiotherapy should be continued. So physiotherapy, I'm using as exercises and physiotherapy, all of these things as physiotherapy. Okay. So I'm writing occupational therapist, the home visit and physiotherapy together. Okay. So like this. Her home condition should be reviewed by occupational therapist within 5 days, and physiotherapy should be continued. Also, arrange a social worker to assist her in daily life activities. So this is how you will write the conclusion and the discharge plan. Okay. So today that is enough. I think you people got a lot of ideas about how to write and all of these things. Let me show you one thing before we go. So we have this tomorrow. I will try to mark your letters. Okay, those who have not sent me letters, you can send me your letters in Microsoft Word file, typed one, and those who have already sent me the letters, I will mark. Okay, tomorrow I will arrange one class for tomorrow. I will mark your letters. Okay, I will give you individual feedback. So we have VIP hybrid course for writing, in which we have daily lectures. We mark 14 letters, 3 referral letters, 3 urgent referrals, 3 discharge letters, 2 letters to non-medical professionals, 1 pediatric patient. In one letter, we have 1 patient, 2 patients in 1 letter. We have GP to GP transfer in case of nurses, 1 community nurse to another community nurse, visit. Fee is 100 British pound, 30% discount is available, and we have speaking feedback available also, individual feedback. And if you only want correction for some letters, is 5 British pound per letter. So tomorrow, send your letters. Those who have not written so far, I will mark your letters. If any of you wants to join VIP hybrid course for writing, mostly in the course we have 14 letters, but after you finish these 14 letters, I mostly continue helping my students till their exam with more correction, with more letters, without extra charges. That is why we have these charges. Okay. So if you have any question, you can ask me on WhatsApp.
Sir, can
And
I speak to you?
your letters, we will arrange tomorrow one new class to mark your letters. Okay. Any question?
Yes, sir, can I speak to you?
Yes, please. Yes.
Yeah. Sir, I already paid for the VIP hybrid class and I got the case
Yes.
notes and Zoom link as well. How can
Yes.
I join for the class?
Today you can see there is a little bit, disturbance in our timetable because our Ramadan, month of Ramadan is announced very late. So now I'm going to say prayer. It would last for almost 1 hour. So if you are awake, I will mark your letter. I will go online after almost 1 hour. Okay. 1 hour, 20 minutes. So we are going to say prayer because it was announced late. Otherwise, daily I will mark your letters. I will discuss with you at 5 p.m. Okay.
Yeah.
Almost.
So I already put the photo of the letter. I think I should write in the Word document, isn't it?
No. For VIP hybrid course, you don't need to write in the word. Is you can send as photo. You can send written. Word
I
file
already
is okay.
I already sent a photo of my
Picture.
letter.
Okay. So just remind me after almost 1 hour, 1.5 an hour. So I will go online because now I have to go for prayer.
Can I make
And
a
other
call
thing
for
is,
that number,
you
sir?
should also write. Yeah, you should also write the next to do this letter that we are going to discuss. We have discussed in the free class today. Write this one also for tomorrow. Okay.
So I don't have that case note.
Okay. Yeah, I will send you. Okay.
Yeah. Okay.
Any other question? This is a new student in the VIP hybrid course. So I
So
share
tomorrow,
question.
can we start at 5 o'clock?
Yes, 5. Yes.
Yes,
If I arrange for free class at 5, then maybe a little bit later because I have to mark free class letters also. But I will update you. Okay, don't worry.
Okay,
Any
sir.
question? Anybody has any question?
I also pay for the speaking class as well, sir.
Speaking, first you will prepare yourself by watching my YouTube videos and these things, because in speaking we have only 8 role plays, that is limited. In writing, you will write first 14 letters that are in the course. After you finish these 14 letters, I will send you new case notes. There are almost 24 more case notes. So you will write those letters also. So if it is possible, because your exam is on 15th of April, I think so.
Yes, sir.
So you can write from me. There is no limit on your number of letters. First, you will finish these 14 letters. Then I will send you a new file. Then you will write. But first, at the first 4 or 5 days, write 1 letter per day. So after I see that you are writing very good letters, and then you can start send me more than 1 letter per day, 2 letters, 3 letters, as you wish. Okay.
I
and
wish
speaking,
to join with you tomorrow 5 o'clock.
Okay. So today I will also mark your letter. Okay.
Oh,
So
thank you
thank you
very
so
much,
much,
sir.
all of you. Thank you so much, all of you.
Oh, thank you, sir.